All right, let's talk about something that's on a lot of people's minds: retirement. And a huge piece of that puzzle: healthcare costs. It can seem super complicated, I know. So today, we're going to cut right through all that noise and give you a straight-up beginner's guide to the official Medicare costs for 2026. So what exactly is Medicare? And more importantly, what's it actually going to cost you in 2026? That's the big question, right? We're going to dig into the official numbers and give you the real deal so you can actually feel confident about your planning. Okay, so here's how we'll break it down. We'll do a quick Medicare 101, then look at Part A and Part B. After that, we'll get into the actual numbers for 2026 and finish up by seeing how your income plays a role in what you pay. Sound good? Let's go. So let's start with the basics. What even is Medicare? Well, it's the government's health insurance program, mostly for folks 65 and up. But here's the key thing to get right away. It's not just one big plan. Think of it like a puzzle made up of different parts, and each part covers something different. All right, let's dive into the first piece of that puzzle. Part A. This is your hospital insurance. It's really the foundation of your coverage for those more serious situations where you actually need to be admitted to a hospital or another facility. So what does that cover exactly? We're talking about your inpatient hospital stays, care you might get in a skilled nursing facility after the hospital, hospice care, and even some home health care. Basically, if you're admitted somewhere, that's what Part A is for. Now, here's some really great news about Part A. For almost everybody, we're talking 99% of people, it's premium free. You don't pay a monthly bill for it. And why is that? Well, it's because you or your spouse have already paid into the system through Medicare taxes while you were working. Pretty cool, right? Okay, let's look at the other side of the coin. Part B. This is your medical insurance. So if Part A is for when you're admitted in a hospital, Part B covers pretty much everything else. Think of it as your coverage for all the day-to-day doctor visits and outpatient stuff. So, what are we talking about here? Part B is what pays for things like your doctor's visits, any care you get at a hospital without being admitted, medical supplies, even things like walkers or wheelchairs. And a big one, it also covers a lot of preventative services, to help you stay healthy in the first place. Just to really paint a picture for you, think about your regular checkups with your doctor, or if you need some lab tests done, or maybe you need some medical equipment at home. That's all Part B. It's really your out and about health coverage for when you're not checked into a hospital. Okay, deep breath. This is what you came for, right? Let's talk numbers. We're about to walk through the standard official costs, the premiums and deductibles that most people are going to see for Medicare in 2026. So first up, the big one, your monthly Part B premium. For 2026, the standard premium is going to be $202.90. Now that is an increase of about $18 from 2025, so it's definitely something to factor into your budget. And then there's the deductible. For Part B, the annual deductible in 2026 is going up to $283. Just a quick reminder, that's what you have to pay out of pocket for your medical care before Medicare kicks in and starts paying. And yeah, that's also up a bit, by $26 from the year before. Okay, let's jump back to Part A for a second. Remember how we said it's usually premium free? Well, that's true, but there is a deductible if you're actually admitted to the hospital. And for 2026, that hospital deductible is $1,736. That's a $60 jump from 2025. We've been talking about standard costs this whole time, but those numbers aren't what everyone pays. Your income can actually make a huge difference in your monthly premium. So let's get into that. This is all about something called the income-related monthly adjustment amount. Basically, it's an extra charge tacked on to Part B and even your drug plan premium if your income is above a certain level. But it's important to know this doesn't affect most people. We're only talking about 8% of folks on Medicare. And just look at the difference this can make. It's pretty dramatic. If you're an individual earning up to about $109,000 a year, you pay that standard premium we talked about, $202.90. But if you're an individual earning $500,000 or more, your monthly premium for the exact same Part B coverage skyrockets to $689.90. Wow. And it's not just Part B. This income adjustment also hits your Part D prescription drug plan. So if you're in one of those higher income brackets, you'll see an extra charge on top of your regular drug plan premium. In 2026, that extra amount will be somewhere between $14.50 and $91 a month. Whew, that was a lot of numbers. So let's do a super quick recap of the key takeaways for 2026. Number 1, Part A, your hospital insurance, is premium free for pretty much everyone. Number 2, the standard Part B premium is $202.90 a month. Number 3, your annual Part B deductible is $283. And last but not least, remember that about 8% of people will pay more because of their income. Got it? So there you have it. Those are the official numbers straight from the source. The costs are laid out pretty clearly. So I guess the only question left to ask is the one that's really for you. Now that you know what the costs are looking like, what are you going to do next to get your healthcare plan for retirement buttoned up?